Everyone, my name is Christina Andeloro, and I decided to do my presentation on listeriosis. I thought this disease was kind of interesting to talk about because over the shadowing opportunities I had, it was talked about a lot, especially with the OBGYN that I shadowed. And so I thought it'd be interesting to kind of research further into it, find out who it affects, what it's caused by, and what it can be found in. So, listeriosis is a bacterial infection. It's caused by the consumption of food contaminated with the bacterium Listeria monocytogenes. Although healthy people are not likely to fall ill, those who are considered at risk for infection, it can be a very serious thing if they contract the infection from eating something contaminated with that bacteria, since they have compromised immune systems. They're not able to fight it off as healthy individuals would be. The bacteria L. monocytogenes is a gram-positive, rod-shaped, facultative anaerobic bacterium. It produces flagella at or below room temperature, but not at body temperature, which is interesting because when it's inside our body, you would think that's when it would want the flagella being produced to move around and infect cells, but in fact, the mechanism by which it infects all the cells is more complicated than just flagella producing. It's also capable of surviving harsh temperatures of refrigeration and freezing, so this becomes particularly difficult when it is in relation to food sources, since we put a lot of our food into the refrigerator thinking that it's keeping bacteria at bay, but in reality this bacterium can survive that. So it's very dangerous to, again, those who are considered at risk. Also, this ability to survive harsh temperatures of refrigeration and freezing is notable because it's non-spore forming, and so a lot of times a bacteria that is able to survive those low temperatures produces endospores, but since this bacterium doesn't, it's a pretty notable thing. So the specific pathogenesis of this bacteria, again, is very interesting. It's not something that I've seen before in class or in lab or during research. It enters into the host cell via a phagocyte. So this is kind of counterintuitive because we normally think a bacteria or a foreign antigen would not want to be phagocytized by the cell or detected by phagocytes. But Listeria monocytogenes actually does want to be phagocytized into the cell. So once it's in that phagosome, it can lyse the phagosome membrane by the production of LLO. It's a phospholipase. And so once it lyses that membrane, it can enter into the cytosol, and that's when it begins to produce actin. And so once that actin is produced, it can move to the outer edges of that original host cell that it had originally infected and push into the neighboring cell. So the way it is able to move past these initial membranes and make these phagosomes is it's producing proteins INL-A and INL-B, and that's what's making those outer membranes of those host cells produce those phagosomes. So again, in the second host cell, once it pushes up against that membrane, it's creating a double membrane vacuole. So it has the original membrane from the host cell, and then it has that new outer membrane also of the new cell that it's trying to infect. So again, we see over here on F the lyse of the vacuole, again by the production of that phospholipase, LLO. And then again, the process repeats. It can enter into the cytoplasm and produce actin and push up against the membrane of the cell, and the process repeats itself. And so we see some scanning electron micrograph pictures of this process. So listeriosis is, like I said, it doesn't affect healthy people normally. It's mostly just dangerous to those who are considered at risk. So according to the CDC, the number for 2013 was incidence of listeriosis was 0.26 out of 100,000 cases. So that's a very small percent of the population who's contracting this disease. We see from the year 1996 to 2006, there was a 4% drop in the infection. So although 4% doesn't seem like that big of a number, when you're considering 0.26 out of 100,000, 4% is a lot. And so that was a big drop. But from the year 2006 to today, it's really pretty standard. There's no change in that incidence of listeriosis. So for the U.S., the biggest outbreak that we have was in 2011. There were 147 illnesses, 33 deaths, and 1 miscarriage, but this was due to, they traced it back to a single farm that produced cantaloupe that were infected with that bacteria, L-monocytogenes. So all those people got sick from that single cantaloupe. So we see in this for 2006, for that 0.29, again, out of 100,000 cases, we see that mostly in the Northeast and on the West Coast, and New Mexico as well. So towards the middle U.S. and South, that incidence goes down to 0.01. So that's pretty low. Also, what's interesting about this disease is it's contracted mostly in the late summer to early fall months, and this is due to the fact that, again, that's when harvest is occurring and the bacteria thrive in those fruits like the cantaloupe from that big outbreak in 2011, and so when those things are harvested in large numbers and sold, that's when we see a lot of the disease onset beginning. So foods that are commonly contaminated with this, and they should be avoided by those who are susceptible to falling ill, are uncooked meats and vegetables, unpasteurized dairy products such as milk and cheeses, processed cooked foods such as soft cheeses, deli meats, seafood. So the reason, you think, okay, well, cooking would kill the bacteria, and it does, but if the L-monocytogenes comes in contact with any equipment from the factory or any processing machinery from, say, a hot dog plant, the bacteria can survive for unprecedented amounts of time just on that machinery. So if other food touches it, so if the cooked hot dogs go back onto the conveyor belt and touch things that were from the uncooked hot dogs, that bacteria can get onto the cooked products. So that's why we see it a lot of times, and those at risk are told to avoid hot dogs, deli meat, things like that, as well as, again, the unpasteurized dairy products, since the high heat of pasteurization hasn't killed that bacteria. So at-risk populations, they're considered to be those with weakened immune systems, such as fetuses, infants, patients with cancer, HIV/AIDS, and kidney and liver disease. And this isn't all-encompassing, but this is the main groups in which we see this disease manifested. Also, those on medications for rheumatoid arthritis and autoimmune diseases are also at risk because, again, those medications are immune suppressing. The elderly over 65 years, again, same reason. They don't have as much as an immune system. And pregnant women. For pregnant women, the cause is a little bit different, and we'll talk about that a little bit later. But for these populations, this is who should be avoiding those foods that are commonly contaminated with the bacterium. So the reason listeriosis is usually talked about in relation to pregnancy is because it's really harmful to the fetus. So it's 20 times more common in pregnant women than the general population to contract listeriosis, and they account for 27% of all listerial infections. Although, like I said before, it doesn't cause much of an illness in the pregnant woman herself. It's mostly harmful to the fetus because it can cross the placental barrier. So that's one of the few things that the placenta can't keep out. So if a woman consumes food products such as feta cheese or deli meat that has been contaminated by the bacterium, by its pathogenesis, it can cross this placental barrier. The symptoms of listeriosis are considered to be bimodal, meaning they can either be very mild or very severe. So again, with the case of pregnant women, the woman herself only gets a mild form of the symptoms. Usually just symbolizes maybe a common cold, but then again, if someone who is considered at risk, such as an immunocompromised cancer patient or the fetus, the risks are very high and the symptoms are very severe. Again, for healthy individuals, the symptoms are like that of the flu. You get the fever, chills, headache, vomiting, so it's easy to be mistaken for the flu. But again, in those healthy individuals, they can usually fight it off, and it's not a big deal. So even if it is mistaken for the flu, antibiotics don't need to be administered for them to be able to fight it off. Although for at-risk populations, those symptoms are very severe, and if it spreads to the nervous system, this is when it can cause meningitis or meningitis-like symptoms, and that can be very damaging. So it's really necessary to properly diagnose it again, since it is their symptoms are like that of influenza. The test to do this is to take a blood or spinal fluid test to isolate the L monocytogens. It can just be isolated on broad spectrum or standard media, and so they can see that bacteria on there, and that's when they can confirm that it is listeriosis and not just a common influenza infection. So you treat listeriosis with antibiotics, just a broad spec antibiotic. But if a person, even including all those considered at risk, consumes a food that is known to be contaminated with the bacterium, but they don't present symptoms, they will not put them on antibiotics, which I thought was kind of interesting, especially for pregnant women. If you know you had consumed food with that bacterium, and you're not put on antibiotics as a precautionary thing, I thought that was a very interesting method of treatment. So again, there are a lot of complications if it's left untreated, especially for that at-risk population. So you can get septicemia, encephalitis, brain abscesses, endocarditis, or localized infection. And so here we see up here, this is what the meningitis looks like if the bacteria is able to infiltrate the nervous system. And so if left untreated, again, it can cause a lot of damage and death, especially in fetuses and those immunocompromised patients.